So thank you all for coming to our information session on our Bridges to Translation 9 pilot funding RFA. My name is Kelsey Stoltzfus. I am the Director of Pilot Programs for the Penn State CTSI. Also on the call today, we have Jack Vandenheuvel and Aaron Lukacher, who are the Translational Endeavor co-leads for the Penn State CTSI. So the three of us are here to answer any questions that you may have. I've been with the CTSI since last October. Jack and Aaron have been here for much longer. So between the three of us, I think we have a good understanding of what's going on, and we can answer any questions you might have. So for those who are not familiar with the Penn State CTSI, we are the Clinical and Translational Science Institute. The Institute is one of 7 interdisciplinary institutes under Penn State's Office of the Senior Vice President for Research. Our vision is to improve human health, promote collaboration, and make the research process more efficient. We also serve as the cornerstone of clinical and translational science at Penn State. Our Bridges to Translation pilot grant program has been going on for almost 10 years now. We're in the 9th iteration of it, this RFA. The long-range goal of the Bridges program is to develop, implement, and make available to the community at large new methods to promote health and predict, prevent, and effectively treat human disease. We fund novel projects that encourage collaborations and projects that work to overcome roadblocks in taking research from the lab to patients in healthcare clinics. If you follow the link at the bottom of this slide, you can see a list of previous awardees and their project titles. So the CTSI Funds pilot projects aimed at building linkages and overcoming roadblocks at any stage in the translational process. So that's what I have pictured here on the right. So these projects may include ones that move research from one phase to the next, so T1 to T2, for example. Projects that focus on translational science, which I'll cover what that means next. And projects that focus on multidisciplinary collaborations between basic scientists and clinical investigators. We also look for collaborations across departments and across campuses, and projects that are in collaboration with community organizations. So a big question right now is, what is translational research and what is translational science? So our current funding opportunity will fund either or both. So translational research, those are projects focused on crossing a particular step of the translational process for a particular target or disease. So that's going from T1 to T2, 2 to 3, 3 to 4. Translational science is a newer field, and those are projects focused on understanding a scientific or operational principle underlying a step of that translational process, with the goal of developing generalizable principles to accelerate translational research. So it's a newer field of focus for NCATS, our larger funder. So we have some special topic areas for our Bridges program. And they are projects that focus on NCATS and CTSI priority areas, which for this round, those are rural health and disparities, diversity, equity, inclusion, and belonging, as well as the translational science principles. So more information can be found on this link here, but they're also pictured here on the right. So there's a variety of those that cover a broad range of topics. So more specifically about Bridges 9, $200,000 is available to support those interdisciplinary multi-investigator projects. That's really what we're looking for. Projects can request up to $50,000 in direct costs. And the project period for this round is July 1st, 2024 through June 30th of 2025. The full RFA can be found at this link, which takes you to InfoReady, and that details everything that you might need to know about this RFA. To be eligible for this award, the PI must hold a Penn State faculty appointment. These can be either tenure track or non-tenure track, and they can be at any Penn State campus. We really open and welcome applications from the Commonwealth campuses, but anybody from any campus is welcome to apply. And then we're also looking for proposals from multidisciplinary cross-campus teams led by a junior investigator, either an instructor or an assistant professor. And those that have a senior investigator on the team would be the most competitive. So that senior investigator role doesn't necessarily have to be a PI. It could be a collaborator or a mentor, but it's nice to have that level of expertise and experience on the project team. So the application process is a little bit different than what we did the last round of bridges. We made some changes. The first is that we have a required letter of intent, and this is due by September 12th at 5 p.m. So that's a strict deadline. And the letter of intent is a one-pager that should include the project title, a brief description of the project and the aims. It should address each of the NCAT's translational science principles. And then additional pages should include a list of all team members, mentors, and advisors, as well as a bio sketch for the PI and any co-investigator or collaborator on the project. So those last two bullet points are obviously not included in the one-page limit, but those first three are. So from those letters of intent, we'll be doing a downselect process. So letters of intent will be reviewed by the CTSI Translational Endeavor Pilots Corps, Jack and Aaron, who are on this call, and myself, as well as the CTSI Executive Committee. And we're going to be looking at scientific merit, programmatic fit, and alignment to the NCAT's translational science principles. Up to 10 LOIs will be selected to submit a full application. And those notifications will be sent out by October 3rd. From here, the invited applications will undergo a consultation period with our CTSI cores. So our cores are listed here on the bottom of the slide. So for example, we have biostats, policy, implementation science, informatics. We really cover a wide range of topics there throughout the research process. And so when we review your LOIs, we're going to be suggesting which cores you should meet with in order to strengthen your applications, further develop it, and refine it. So if it's a really stats-heavy proposal, we might suggest that you meet with BIRD. If we think you could benefit from implementation science, we would request that you reach out to the implementation science core. So you have from October to December to meet with the cores and put together your full application. And in the application, you would write a section on how you changed your application or strengthened your application based on these consultations with our cores. So now some of the nitty-gritty budget details. Allowable expenses on these awards, we can have up to $10,000 allocated to total faculty salaries. That does not include fringe, so $10,000 over one PI or multiple faculty members on there. You may have additional salaries or wages going towards coordinators, techs, nurses, or graduate students. Of course, other study costs would be allowable, such as gift cards or lab fees, materials, anything like that. And then you may budget up to $2,500 for publication costs. Disallowable expenses, we do not allow F&A costs or your indirects. These projects are not intended for student or postdoc-led research. You can pay for a portion of those individual stipends from these funds, but they should not be doing their own project. That would be to work on the PI's project. Funds cannot be used for tuition, and funds should not be used for activities usually supported by departments and colleges, such as software and travel to conferences. Publications are allowed. Some more administrative details. IAS will not be used. These are internal awards, so we don't use that process. We prefer that you submit a SIMS budget, but if you're not comfortable with SIMS or not familiar with it, an acceptable Excel template is available upon request. And then if you are notified that you'll be moving from the LOI stage to the full application stage, at that point, we're going to ask that you provide the contact information for your pre-award person in your department, your DRA, and your FA. So they're looped into the process early and they are aware that you're submitting the application. They're also a great resource for you. So we like to loop them in as early as possible. The full applications will be then reviewed with the following review criteria. So we look at significance, innovation, approach, investigators, and collaboration. We use an NIH style review, scale of 1 to 9. And this is done with external reviewers. So we have partners at external CTSAs across the country who review the application, and then we look at them here within our pilots core and the executive committee and decide ultimately who to fund. If you are chosen, there's some additional requirements as a condition of the award. First, some just-in-time information might include a signed letter from your department chair and collaborators if that wasn't previously included in your application. And of course, disclosure of any conflicts of interest, again, if that wasn't in the full application already. Any application that involves human subjects or vertebrate animals or both must receive full regulatory approvals before receiving access to funds. So we would have award letters go out in April is the intention, with projects starting in July. So those couple of months should be used to receive IRB approval and then do the prior approval process, which I'll discuss next. So awards are federally funded, and because of this, they require NCAT's prior approval for those human subjects and vertebrate animal studies. This requires additional documentation that you are to complete. It can also require additional time, up to 30 days, depending on the level of your study. If you are doing a non-human subject study, then this is not applicable to you. Some new things that we've added in for this round of funding is a Bridges to Translation orientation meeting, which will be held the month before projects are set to begin. This will be a time for PIs to all get together with me and our co-leads to get to know one another, share what your projects are about, but then also go over some of those regulatory requirements for the award, such as the prior approval process, which can be complicated for some folks, as well as our progress reports, timelines, those nitty-gritty details. We're also asking that the teams participate in a team science training prior to their award start date. This is led by CTSI teams and collaboration core lead Susan Simpkins. This can be held either virtually or in person, and it's a great opportunity for you and your team. Most of these are new collaborations to get together and discuss some of those details of how you handle publications and communication and those different team science details. Additionally, the PI and key personnel must agree, if called upon, to serve as a reviewer for future rounds of CTSI pilot funding proposals. This can include our pilot funding opportunities as well as those external CTSA partners that we work with. So they review our proposals, we review theirs. So if you are a subject matter expert, we would ask you to review those. And then any manuscripts that you submit that arise from this CTSI funded project need to be submitted to PubMed Central upon acceptance for publication. So you have to cite our grant and then submit it to PubMed Central. So as you're putting together your applications or your LOIs, any questions about the guidelines or eligibility, the application process or the review process can be sent to ctsi@pennstatehealth.psu.edu, and I'll respond to you on those emails. If you have questions about the SIMS budget process, you should reach out to ORA at eGrants and they can assist you with that. And then once again, the full RFA can be found at this link, which takes you to InfoReady, which has all of our details about the competition. So that was my presentation for everybody. I'm going to stop sharing now and open up the floor to questions. The slides will be shared, yes.
This is Jack. I just wanted to say that this round, the letter of intent is more important. So please make sure that you understand the key material that needs to go into that letter, because we're trying to do some down select so we have less full grants that are going for review.
See some questions in the chat here. Do we only need to have one senior investigator, or can we have 2 or 3? You can have as many as you would like. Again, projects that have a junior investigator will be given priority, but you can have, we've had teams of 8 submit a proposal So there's really no limit on that. Do we need a budget in the LOI? No, you do not. If most people request the full $50,000, so if you have an idea, but I know the budget can kind of come up to a last minute decision. So no need to have the budget in the LOI. I'm working with a urology faculty member who is interested in an engineering faculty member, student collaborator, will be able to help with those connections. Absolutely. So if you need those connections, we have a lot of those already. And then we have folks within our institute who are great at making those connections for you. So send an email to that CTSI general email, and we will follow up with you and make those connections and help facilitate that. So yes, please do that. Is the expectation that there is a single PI and other folks to be co-Is? We've had projects submitted several ways. We have one project that we just funded that has 3 co-PIs. Others have a lead PI and then just co-Is. So it's really up to you. I think it depends on the work that's being done and what makes the most sense for your team. Is an associate professor considered a senior? Generally, we just consider assistant professors as our junior faculty. If it's a full professor, there's weighting a little bit more than the associate professor. So we consider assistant more than associate, but they're not disregarded as an associate professor being junior, if that helps. And I will say one of our focuses right now for the CTSI is that rural health aspect. So if you have a partnership with a community organization or a community partner of some way, those are given a lot of priority because that's one of our focus areas. Yeah. Can you explain more what exactly pilot projects are? Yeah, so Jack and Aaron, feel free to chime in here if I'm speaking incorrectly on this, but the pilot projects are really money to get an idea started that you haven't worked on before. So this really shouldn't be a continuation of an existing project, or your NIH funding is done, you want to do something else. It's a new idea that you're looking to build a new team, new collaborations, and just kind of get that money to get started. And then ideally it would lead to external funding.
I think that's a key point, that we are critiqued by how well our pilot projects do at getting external funding after the pilot. So it's really supposed to get the ball rolling for a successful translational project.
And the follow-up question, what about if it is tested in a different setting? Yeah, I think that's definitely to be considered. Pilot testing, if it's a different population, or if you're going from thinking about that translational research map, if it's no longer in a lab setting but a patient population, that would be a different setting. Yeah, they're pretty open. It really depends on the reviewers who review them and what other applications we get that cycle of kind of what we compare them to. Can this be a pilot clinical trial? I'm sorry, were you gonna, someone responding?
No, I'm just saying thank you for the last 2 questions for me. So the reason I'm asking is, I'm thinking like there is a tool which was tested in a different setting, like a different state. So I'm kind of thinking, through, kind of do that like in the state of Pennsylvania. I mean, the tool, like, so basically it goes to the population, like, focusing on public health. So
yeah, I would consider that a pilot project. Jack, Aaron, I'm not sure if you would, what you would think.
I think one of the critiques is innovation as the full grant gets looked at. So if it's just doing Me Too, that you're going to do a different population, that might be considered not innovative. But if it's somehow adapting and looking at a completely different population, completely different disease state, then that might be considered innovative.
Yeah, I think that's the kind of the plan, just to I mean, the idea is like it's like a cross-cutting, you know. So previously we've been tried for HIV, maybe this time thinking like to try this more for maternal health issues, you know, like with the community.
Thank you,
Thank
Jack,
you.
for clarifying that. I think that's exactly right. It's the innovation piece that you should focus on there. Some more questions in the chat. Can this be a pilot clinical trial? Yes, we do fund clinical trials. They're a bit more complicated, I will say, from the prior approval standpoint with NCATs, but they can be done. Is there a limit on other personnel costs aside of the 10K for faculty? No. So if you want to use 10K for faculty and the remaining 40,000 for staff time, you can do that. We just need a budget justification. Are projects with animal work eligible? Yes. So you can do, we've had projects that are just humans, just animal, combination of both, and then non-human subjects, non-animal. So you can do both. Animal work still requires IACOC approval and then NIH prior approval as well. Do we focus in morality to be eligible for selection for full submission, or the reviewers look at the whole idea? So we'll be looking at the whole idea. So the LOIs, we'll read through the whole thing. We're going to look at it for overall programmatic fit. If it does focus on the special topic areas, there'll be priority given. We're going to look at the project team, if there's collaboration across campuses, impact, everything that you stated, yes. And are KL2 scholars eligible for this funding? Yes, they are. Yep. So I would reach out to us just so we can chat about what that looks like. But we have another scholar that has already received pilot funding. So we can chat later, Lena, or we can loop in Jess Petrie if we need to. And is there a limit on the number of collaborators? No, there's really no limit. I think you should be mindful of the amount of work that people can do on such a small project. $50,000 can only get you so far. So just be mindful. You don't want to submit a project with a ton of collaborators where they're really not providing much. So just be mindful of that, I would say. All right, another one. If the proposal is addressing the last category listed, the AI, is the expectation that there's both development of the statistical methods and translation, or is it reasonable for there to be a plan to apply for future translation funding once the pilot develops the method? You do not need to include both. It does not need to address both the stats methods and translation. You can keep it simple. I hate to say simple because it's probably not simple, but you don't need to do both. You could just do one, and then in your proposal say we plan on applying for external funding to do X, Y, and Z. How many LOIs can one PI submit? That is a great question. I don't think there is a limit. I think last year we maybe had one PI submit 2 at the max, but Jack and Aaron, has that been something in the past? I don't think I've encountered that yet.
We have had a couple of PIs that have submitted 2. I don't recall any more than that, but I think 2 has been the max that we've seen proposals in one cycle.
So I would stick with 2 as the max. Any other questions? I'll give it another minute here in the chat. But you guys can all reach out to either the CTSI email address, that's CTSI@Penn State Health, or feel free to email me directly if you have questions, or Jack and Aaron. We'll send out the slides, and emails are listed on there. At the very least, names are. We're happy to set up a separate time to chat if you would prefer that. But we're really looking forward to this round of funding and looking forward to reading all the LOIs that, again, are due on September 12th.
And how are people going to get the slides?
We have everyone's email from the registration for the meeting. So I will have Ellie, our Director of Outreach, work on sending those out to everybody.
Thank you.
And the project is community-based, not campus-based. How do you recommend we find our PI? So the PI needs to be a Penn State faculty. So you need to work with somebody here. I would then, if you have a collaborator, if you have a community partner in mind, reach out to them, and you can reach out to me to see how to best structure your team, if that would be helpful. We also have a director of, blanking on her title right now, Nicole Tarr. She's our go-to person for building these community partnerships. We also have our community engagement core. We have other resources. So if you're looking for that community partner, reach out to us as well, and we're happy to help you establish that relationship. But the PI needs to be a Penn State faculty because they are internal awards. So all of the money can't be leaving the institution. Did that answer your question? Sounds good. Thank you. All right. Well then, I will, like I said, send out the slides here. If you have any questions, reach out directly, but if not, thank you all for attending, and we look forward to reviewing your applications. Thanks.